Now let's look at the parasympathetic autonomic nervous system. So when we're looking at the PANS, these are known as cholinergic drug. And so again, how can you remember this? So remember we said for SANS, it's known as adrenergic drug. So think of the adrenaline high that he has or that's going through his body. With this one, maybe you could think of, I don't know, this may be silly, but when I look at this, I think of chlorine, like the chlorine pool. And so think of maybe you're at a resort and you just ate a lot and you're chilling by the chlorine pool. So what's happening to you? You're feeling very relaxed, right? Think of the chlorine pool that you're sitting at and you're just resting there and relaxing and digesting. So cholinergic drugs. So if you take a drug from the cholinergic family of a cholinergic drug, what happens? Well, what happens is that you are going to feel like this. So if you have a dry mouth, you're going to take a drug from this category so that you can stimulate your saliva, you can get more salivary flow. So pilocarpine is used, is a good example rather of a cholinergic drug because pilocarpine will make you feel like this so that you can salivate more. So it's used to treat dry mouth, it's used to treat xerostomia. If you want this to not happen, if you don't want to feel this way, if you want to feel the other way, you could take an anticholinergic drug and it produces the opposite effect, okay? And I'm just going to correct my spelling mistake over here. There we go. So it's going to create the opposite effect. And for that to happen, what we're going to do is we're going to look at this diagram again so we can have a better idea. So if you are taking a cholinergic drug, okay, let's review. If you're taking a cholinergic drug, right, parasympathetic, cholinergic, the drug is traveling through the preganglionic, postganglionic neurotransmitters, and the drug is being released. And what it will do is it will tell the neurotransmitters, okay, bind to the receptor. So let's say it binds to the lungs. And when it binds to the lungs, it will tell the lungs to slow down because it wants you to feel more relaxed. So you won't be huffing and puffing. If you take an anticholinergic drug, for example, the signal will travel through. Okay, so it goes through the preganglionic neuron, then postganglionic neuron, and then it will block the receptor, block the cholinergic receptor. So what that means is that it will block the beta-2 receptor, and when the drug blocks the beta-2 receptor, what will happen is that the lung will not slow down, right? It's the opposite, so it's the opposite effect. So it will tell the lung to start pumping faster. So it's not this. We don't want this reaction. We want the opposite reaction. So notice over here that there are this and this kind of goes hand in hand, and this kind of goes hand in hand. So here we're using the example of salivary flow. So pilocarpine is an example of a cholinergic drug. So a drug that gets traveled through, and when it binds to the salivary gland, what it will do is it will tell the salivary gland to start producing more saliva. But if you do the opposite, if you take a drug that blocks, so an anticholinergic drug that blocks the receptor, what happens is the signal will travel through, the drug will go through, and when it binds to the receptor over here, the salivary glands will stop salivating. And when it stops salivating, your mouth will feel drier. So atropine is an example of a drug that is anticholinergic because it decreases salivation. It stops the salivary glands from stimulating saliva. So one more slide that I want to show you guys over here is that this is from the textbook, which is actually really cool because what it does is it tells you that if you take a drug from the sympathetic or adrenergic category, the drug will interfere or will work with the beta-1, and if it works with the beta-1, it's going to affect the heart. As we know, 1 stands for one heart. And what will it do? Well, when you have the sympathetic or adrenergic response, your heart rate will increase, as we see here. This guy's heart rate is increasing. If you're doing the parasympathetic, cholinergic response, if we're looking at that, and the receptor or the drug, the neurotransmitters affect the beta 1, it will decrease the heart rate, because as we see here, her heart rate is decreased. She's relaxing. So over here, it just tells you the receptor and what it's doing. So beta 2, what does it do? It dilates or opens up the heart, the lungs, so that we can breathe a lot more better. Whereas if it is the parasympathetic, what does the beta 2 receptor do? It helps with constricting the lungs, because you don't need a lot of oxygen in your lungs to breathe. You can do with just a little oxygen. And so if you go down over here, it actually tells you more stuff. So what happens to the mucosal lining? It constricts. What happens to the lungs, right? In this one, it opens up. So dilation, right? Beta 2 refers to lungs. The lungs open up, dilate or open up, right? So it means the same thing. And when it opens up, you're given more air so that you can run away from the bear. So this is just basically a summary of what happens to the organs or to the body, depending on the response that your body is going through, depending on whether it's sympathetic or whether it's parasympathetic.